We're spending part of our lunch hour with dentist Dr. Stephen Marsh from his office. And Dr. Marsh, you were a guest on the original Good Company show many, many times.
Yeah, and it's a pleasure to be back on Good Company, and to especially nice to be with you again, Joe, because we've also worked together quite a long time.
Yes, we have. Here it is, springtime baseball season. How about that?
Yeah, so it's funny you mentioned baseball. I'm a baseball sort of guy, and in our office, we often give a patient a soft squeeze ball because sometimes it helps depending on the procedure we're doing, and it just helps people relax. And if nothing else, they've got a little toy for their grandchild or child or dog. So we try to have those in every room.
Awesome. You know what? Springtime is also a brighter time as well. The colors start blooming a little bit, and so should our smiles.
Absolutely. And Joe, some people will come in and they'll say they want whiter teeth. And if it's not a very involved case, we'll do Zoom in the office. That's one way. It takes about an hour and a half. Or we'll put whitening gel in a custom tray that they use. And they can use it anywhere from 15 minutes to a half hour, once, twice a week. And it gives them that bright, beautiful smile. But unfortunately, it doesn't work for everybody.
In terms of color, what could people do? Is brightness the same as the color of the teeth?
Well, no, it's very different. In some ways, it's like a white color for a paint. Sometimes you can do an off-white, that sort of thing. And we can literally customize the color. And the best way to do it is either with bonding or porcelain veneers, where we can actually choose the color or shade that they're looking for.
What do you say we feature some of your patients that change the color a little bit?
It'd be my pleasure, Joe.
Who's first?
So my first patient is Olivia, and you can see those dark front teeth, Joe. She had actually fallen when she was a young girl. We see that quite often. The teeth had died, they had root canals, and the teeth turned dark after a while. Bonding was placed, but she wanted a good look for this summer, so we did a couple of porcelain veneers
Wow.
on the front two teeth, and we raised the gum tissue and with a laser and gave her a beautiful smile.
Looks like two different smiles.
Thank you. She appreciated it too. And next was Hallie. Hallie was born with what's called decalcification. This is sometimes happens when the permanent teeth come in. Not much you can do about it. Sometimes it's not very deep, and you can actually polish that whiteness off. In her case, she realized that that was not an option, so we did 6 porcelain veneers. And actually, Joe, just this week we added 2 more to each side to give her a broader smile. But you can see the difference between her smile before and after.
You certainly can.
So I mentioned Hallie had decalcification. There's other people like John. And in John's case, he had something called tetracycline staining. It happens when a mother may have taken tetracycline when she was pregnant, sometimes in young kids who have an
Mm.
infection. And it leaves the teeth very brown and stained. There's not much you can do about it. They don't respond well. So with John, we did 10 porcelain veneers to give him that beautiful smile. And he said in the future, thank you, he'll do something with the lower.
It's
Uh,
incredible.
Thank you. And I mentioned this tetracycline stain. It doesn't only happen to little boys. It happened to Lisa. Her teeth were also male shaped, and over the years had worn down quite a bit. Lisa was in her 60s and said, "It's about time I take care of myself." She's raised 3 kids. And in Lisa's case, we did 8 porcelain veneers to give her that beautiful smile. And she said, like many do, I should have done it years ago.
Right.
And last is Andrew. It's a pretty drastic situation. He had worn his
Incredible.
teeth down. Thank you. We talked about different options. And again, because we also had to change the shape of the teeth, we used porcelain veneers and crowns to give him this beautiful smile. He is dating again, and he said he wouldn't, the way his teeth looked before, and he couldn't be more thrilled with the result. And quite frankly, we felt the same way.
Well, if you want to put a little spring into your smile, let Dr. Marsh and his team do just that. Simply give them a call at 440-461-1003 or log on to clevelandsmiles.com. Thank you, doctor.
My pleasure, Joe.